Hi, I'm Jordan McDonald, staff writer with GovCIO Media and Research, and today I'm joined by Dr. Neil Evans, Program Executive Director for Electronic Health Modernization at the VA. Dr. Evans, thank you so much for joining us.
It's great to be here.
Dr. Evans, you are the go-to person when we talk about EHR modernization. Understanding that the timeline for deployment is 2031, today in 2025, where are we on that timeline?
Oh, it's great question. So we, in VA, we are live currently with the federal EHR, as we call the record that we're deploying. We're live at 6 of our VA medical centers, 26 community clinics, which are associated with those hospitals, and over 100, I think it's 104 remote sites like telehealth hubs and clinical call centers that support those medical centers. We have a plan to be fully deployed at over 170 hospitals and over 1,400 sites of care by 2031, as you mentioned. But right now, we're super excited and focused on deploying the federal EHR at 13 new sites in 2026. So starting in April of 2026, which is just a couple months away in the grand scheme of things, we're going to be going live at 4 sites in the state of Michigan: Detroit, Ann Arbor, Battle Creek, and Saginaw, followed by a wave of sites in southern Ohio, then Indiana, and then Cleveland and Anchorage.
Mm-hmm. And so understanding that we're sort of in the early stages of the full-scale deployment to 2031, that timeline, and that there's been a lot of lessons learned throughout the pause portion of the rollout. I guess the question I want to ask is, how have you met those challenges head on and learned from them and then spread those lessons to other agencies?
Right. Well, I think, as you know, the federal EHR is a common record. It's one system that's being used by 4 different cabinet-level agencies. So the Department of War is our partner, the Defense Health Administration, and then also the United States Coast Guard, the National Oceanic and Atmospheric Administration, so Homeland Security, Department of Commerce, and of course the Department of Veterans Affairs, all one system. Sometimes I think that folks think we're deploying the same technology. We're not just deploying the same technology, it is the same system. All of the records and all of the users logging into that same system really across the departments. And so we talk together all the time. So to the part of your question about how are we learning together, we're learning together because we're living in the same house together. And so we have an opportunity to regularly share best practices with each other and learn from each other. And as we think about, as we in VA are driving forward with our accelerated deployment, a lot of what we've learned is what we learned from the DoD, who did the same thing several years ago. On the topic of what did we accomplish that really is giving us confidence to move forward over the last couple of years, we spent a lot of time, I think of it in many different ways, right? First, making sure the technology was rock solid and performing for our end users. Second, really addressing some of the decisions that we had made early in the program to optimize the configurations of the system to really work for our end users. After we had 6 sites live, we've been able to learn a lot about what will work for us and make some changes to the system to really optimize it for each of our end users. So again, being really careful to listen to our end users. And then number 3, making changes to allow us to operate at the enterprise level to accelerate deployment, right? What are the changes we need to do? For example, we revisited our deployment methodology. We're going to be going live in waves of sets of medical centers that together go live together. So 4 sites in Michigan, 3 sites in Ohio, et cetera, as we move forward.
Yeah, that's really fascinating. We talked a little bit about information sharing and how you're engaging with other agencies, a little bit about the timeline to 2031. I guess I want to ask, thinking about the criteria that you've outlined here for engaging and understanding how the rollout's going at these different facilities, what does the future hold for the EHR program?
Look, one of the things that's exciting to me is VA really operates as a deeply integrated healthcare system. Regardless of where veterans are receiving care, we want to be there for them. And that should be a consistent experience, regardless of where in the country somebody presents for care. And this is a real opportunity by having a single enterprise instance of an electronic health record for the entire country is really an opportunity for us to continue to improve on that experience that veterans have as they engage with us, and to have the information system that undergirds our being an integrated system. And so that's, I think, to me, that's the most exciting part of this project.
Absolutely. Well, Dr. Evans, thank you so much for joining us.
Of course. Thank you.